Good morning, everyone. Now, we talk a lot about Halloween during the month of October, but did you also know that it is Orthodontic Health Month?
Well, Dr. Kurt Kacer is here to explain the overall benefits of orthodontic treatment and what candy to avoid this holiday if you already have braces. Doctor, thank you so much for joining us again.
Thank you for having me.
It's so great to have you. Now, we know that getting braces and things like that are going to help our appearance.
Yes.
But are there also health benefits?
Yeah, there are. They're actually being able to clean the teeth, especially in long term with the functional benefits of getting the teeth arranged into the right position can really help out long term with it.
So, of course, we're talking about oral health, but does
Yes.
it also kind of affect everything? Because I am a true believer that we don't realize it, but what goes on in our mouth and what we do and how well we take care of it really affects our whole body.
Yes, yeah, and it's all tied together, and
Yeah.
it starts with that too. That good oral health really leads to overall body health. You know, it's one of the first steps in that as well too.
So we're talking about good oral health, and I know that a lot of times if their teeth are, too tight,
Yeah.
we can't get in there with dental floss or even with a toothbrush. So what are maybe some just general tips for kind of maintaining that good oral health?
Yeah, it starts with brushing and flossing. And like you're saying with the orthodontics, being able to straighten out the teeth just makes it even easier to brush and floss and to get the cleaning that we want to. So you're exactly right. When you have the overlap, even before braces, it builds up. It leads to poor oral hygiene as well. And so orthodontic straightening out allows that better cleaning, better overall health.
Now, orthodontics, I'm glad you're saying that because I think some people just think braces and that's it and that's all that we can do. So who is a good candidate to be looking into orthodontic health?
Yeah, and almost everybody's a candidate for orthodontic treatment. We have a lot of people who aren't teenagers, right? So adults, and there was, I think, a 73-year-old that we had in treatment just recently as well. Most people, we usually see kids around age 7 is the first time that we really start to monitor them. And so that's our guideline of really when we start to initially see the exams.
Well, I know that a lot of adults now are getting braces and things like it, which I think is really cool. I actually have a girlfriend that just got some clear braces,
Yeah.
and she's having fun with it with rubber bands and things. I mean,
Yeah.
why not? And I think that's really becoming a trend, is that it's not too late to kind of fix your smile. And now we're hearing, that it really does have health benefits as well when you do that. So I'm curious, though, for those of us with children, I know my stepdaughter, you can already tell that there's going to be some need there.
Yeah.
But she's 11, so I'm not sure exactly when I should be bringing her in to see an orthodontist.
Yeah, and actually the sooner that we can see them, the better. And kind of the reality is if we see them at age 7, from 7 till about 12 or 13 when the permanent teeth are in, we only treat about 5% of those patients. So we'll see them from 7, starting at age 7, until the permanent teeth are in, and most of them, the majority of them, won't get treatment, but it allows us to intervene in certain situations where it can really help, with the goal being to do it in one phase with kind of teenage braces and to get the best results there. So there's a lot of things that we do from, let's say, age 7 to 11 or 12 that not even braces related, but just from an oral health and a dental standpoint that we can help with. So kind of your question is we would love to see them around age 7 and then follow them until the point, even though they may not be ready for braces till 11, 12, 13.
Okay, so
Yeah.
that's a good time period, and don't wait until you think,
Exactly.
okay, now we've got that problem.
Yes.
Kind of like you said, follow it along and see what we can go ahead and take care of.
Yes.
Now, and we've got so many different options when it comes to, Invisalign and all these different things. I know we've got that A block, that we have for the braces.
Yes.
So there's never a bad time. And I know a lot of adults, maybe their, parents didn't have the money to do it when they were younger or something like that, and it's something that bothers them. Do it at any moment.
Yeah.
My mom, she had Invisalign later in her life. It was just something small that she wanted to fix, and that was something that made her just kind of feel better.
Yeah.
But going back to the kids,
Yeah.
like we were saying, Halloween,
Yes.
it's here.
Yes.
And I said, I can't wait to see what candy the dentist is going to tell me is good for us. But
Yeah.
there are some certain candies that we should be extra avoiding, especially if
Yeah.
maybe we have braces.
Yeah, yeah, and especially with braces, you get the real sticky candies are the ones that really cause the most problems. So, like we have here, dots and sugar babies, they get around the brackets and the wires, and it's really hard to clean off. And so, if you're talking about like a Kit Kat or a Reese's, it's a little bit easier. It's not as sticky, right? So normal brushing and flossing can usually help with that. But the real sticky candies are the ones that we see that can really cause a lot of problems with patients who are in braces.
And what is it that's the problem exactly? I know it can get stuck in there and maybe we're not seeing that there's a little piece stuck in there and that could probably cause decay, but can it do damage to the actual braces themselves?
Yes, the braces, then the tendency is that the braces come off the tooth, right? Which from the orthodontist point of view, we're fine. We can fix any of that, but it's another trip to the orthodontist,
Right.
taking kids out of school as well too. So the bracket can come off the tooth, but it really is more for kind of oral health and the fact that it's so sticky and it's so hard to clean,
Actually,
brushing and flossing.
I have to admit something.
Yeah.
When I was a kid,
Yeah.
I was the product of this. I had a bracket come off this tooth because of a milk dud.
See, there you go.
So,
we should have had milk duds
I
out
can
here
say
too.
I am proof that that is a thing, and that was an extra trip to the orthodontist.
Yes.
Really?
Yep.
It sure was. So don't be careful. Not those sticky ones.
Yep.
Stay away.
That's really,
It's not worth
funny.
it.
Doctor, thank you so much. This was really eye-opening. A lot of stuff that I'm sure our viewers weren't aware of, and that age 7 is a great rule of thumb to kind of keep in mind.
Yeah.
So thank you so much for stopping in.
Thank you.
Absolutely. Now, Ortho Pros is offering free consultations and braces for $99 per month. Also available are Invisalign, traditional braces, and that Block A braces that I know everyone loves. For more details, you can call 290-8787 or visit orthoprostucson.com.